Hi, my name is Sinead Whelan. I'm the Diabetes Nurse Specialist for Pregnancy in Tipperary University Hospital. My role as Diabetes Nurse Specialist is to provide care for women whose pregnancies are complicated by diabetes. The diabetes team is made up of clinical nurse specialist, dietitian, consultant endocrinologist and consultant obstetrician. All women who attend Tipperary University Hospital for their antenatal care are screened for the risk of developing gestational diabetes at their initial booking visit. If you have the risk factors for gestational diabetes, you will be referred for an oral glucose tolerance test between 24 and 28 weeks of pregnancy. For this test, you will be asked to fast from 10 p.m. the night before the test. You will attend the blood room for a series of blood tests. Your first test will be a fasting glucose level. You will then be given a sugary drink, which you will drink over 10 minutes. A further test will then be taken 1 hour after this drink and again at 2 hours after the drink. You will need to remain in the department throughout the test and not eat, drink, exercise or smoke until the test is completed. If you receive a positive result, you will be invited to attend a group education session with myself and the dietitian Anya that takes place on Tuesday mornings. At this group education session, you will receive information on what gestational diabetes is, what it means for you and your baby, and management of gestational diabetes. 1 in 8 pregnancies in Ireland will be complicated by gestational diabetes. Pregnancies complicated with diabetes are deemed high risk and require closer monitoring until the delivery of your baby. Treatment for gestational diabetes starts with changes to your lifestyle, following a healthy eating plan and exercise with support from the diabetes nurse specialist and the dietitian. We closely monitor your blood levels and further treatment, if required, will be discussed with you. After the delivery of your baby, we'll advise you to book another glucose tolerance test with your GP at your 6-week checkup. This GTT will ensure that blood glucose has returned to pre-pregnancy levels. You are also advised of the risk of developing gestational diabetes in subsequent pregnancies and developing type 2 diabetes at a later stage in life.